Hello learners. Did you know about the elbow joint? So keep an eye out and learn about. The elbow joint is a joint between the lower end of the humerus and upper ends of the radius and ulna bones. It is a hinged variety type of synovial joint. Elbow joint is the term used for humeroradial and humero-ulnar joints. In this article we shall look at the anatomy of the elbow joint, its articular surfaces, ligaments, bursa, relations and movements. Articular surfaces of elbow joint. It actually includes two articulations. A. Humero-ulnar articulation, between the trochlea of the humerus and trochlear notch of the ulna. B. Humeroradial articulation, between the capitulum of the humerus and the head of radius. The upper articular surfaces. A. The capitulum and trochlea of the humerus. B. The coronoid fossa lies just above the trochlea. C. The radial fossa just above the capitulum. The lower articular surfaces. A. Upper surface of head of the radius. B. Trochlear notch of the ulna. The elbow joint is continuous with the superior radio-ulnar joint. The humeroradial, humero-ulnar, and superior radio-ulnar joints are together known as cubital articulation. Ligaments of elbow joint. A. Capsular ligament. It is a fibrous sac enclosing the joint cavity. The inner surface of the capsule is lined by the synovial membrane. Superiorly, it is attached to the lower end of the humerus in such a way that the capitulum, trochlea, radial fossa, coronoid fossa and olecranon fossa are intracapsular. Inferomedially, it is attached to the margin of trochlear notch of the ulna. Inferolaterally, it is attached to the annular ligament of the superior radio-ulnar joint. B. Ulnar collateral ligament. Also known as medial ligament. It is triangular in shape, and its apex is attached to the medial epicondyle of the humerus, and base to the ulna. The ligament has thick anterior and posterior bands. These are attached below to the coronoid process and the olecranon process, respectively. Their lower ends are joined to each other by a transverse band. C. Radial collateral ligament. Also known as lateral ligament. It is a fan-shaped band extending from the lateral epicondyle of humerus to the annular ligament. Bursa related to the elbow joint. 4 important bursa are related to the elbow joint. 1. Subtendinous olecranon bursa, a small bursa between triceps tendon and upper surface of the olecranon process. 2. Subcutaneous olecranon bursa, a large bursa between skin and subcutaneous triangular area, on posterior surface of the olecranon process. 3. Bicipito-radial bursa, a small bursa separating biceps tendon from smooth anterior part of the radial tuberosity. 4. A small bursa separating the biceps tendon from the transverse band. Relations of the elbow joint. Elbow joint is related to anteriorly, median nerve, brachial artery, brachialis, and tendon of biceps brachii. Posteriorly, triceps brachii, anconeus, and nerve to anconeus. Medially, ulnar nerve, flexor carpi ulnaris, and common flexors. Laterally, extensor carpi radialis brevis, and common extensors. Blood supply of the elbow joint. The blood supply to the structures of elbow joint is done by anastomosis around the elbow joint. For details, watch video from link given in description. Nerve supply of the elbow joint. The joint receives branches from the following nerves: ulnar nerve, median nerve, radial nerve, musculocutaneous nerve. Movements of the elbow joint. Elbow joint permits only 2 movements. 1. Flexion. Flexion is produced by brachialis, biceps brachii, and brachiradialis. 2. Extension. Extension is produced by triceps brachii and anconeus. Thanks for watching. Don't forget to subscribe, like, share, and comment down.